Planning. Your first radiotherapy appointment will be for planning. The treatment is planned specifically for you, so to enable this we will need to have a CT planning scan. This should take about 20 to 30 minutes. Why do you need a planning CT scan? The CT scan enables us to see the exact position of your prostate or prostate bed. It also shows us the position of the other organs in your pelvis that we want to try and avoid with the radiotherapy. All this information enables us to plan your treatment accurately. It is important that you let us know as early as possible before your appointment if you are diabetic and are on metformin. Please call 020 3826 2622. This is because you may need to have an injection before your scan. We would ask you to arrive 1 hour before your planning appointment. Please check in at the reception desk and have a seat in the main waiting room. A member of the radiotherapy team will call you into a private room and explain what will happen during your appointment. You will be asked to try and empty your bowels and your bladder before your scan. It is important to have an empty bowel for your treatment. The scan on the left is the planning scan. The scan on the right is a scan taken on the treatment machine just before treatment. You can see by the red markings how the shape of the prostate has changed because the rectum is full. This means that the treatment may not cover the whole of the prostate. Before the treatment is given, the radiographers ensure the bladder and bowel are the correct size, which will mean the prostate is in the correct position and will be getting accurate treatment. Depending on the treatment you will be having, you will either need to have an empty bladder or a full bladder. If you are having the pelvic nose treated or the prostate bed, you will be asked to have a full bladder. By having a full bladder, the small bowel is pushed out of the treatment area, which leads to fewer side effects. The radiographers will explain this to you. If you need a full bladder for the planning and treatment, the radiographers will advise you when to start drinking and how much to drink. Whatever you are asked to do for your planning scan will be repeated for your daily radiotherapy. You will be taken into a CT planning room. The radiographers will introduce themselves to you. Please note that during your planning and treatment you will be seen by both male and female radiographers. At all appointments, the radiographers will ask you for your date of birth and your address for identification. This is a legal requirement. For your planning and treatment, you will need to remove your trousers and your shoes. The radiographers will maintain your dignity as much as they are able to by covering you with paper. The radiographers will help you onto the bed and will position you lying flat, with a support under your head, your knees and your feet. Try and relax. This is the position you will be in when you have your radiotherapy, so please tell the radiographers if you are not comfortable. You may be in this position for up to 20 minutes. When you are lying on the bed, the radiographers will be talking over you, calling out different information and taking lots of measurements. They will draw some marks on your skin with a pen, and they will put some small markers onto your skin with tape. These markers show up on the CT scan. Please do not talk to them while they're doing this. There will be time for questions later. The radiographers will move the bed up into the scanner. When they are ready, they will check you're okay, cover you with paper, and then they will leave the room. You will feel the bed move into the scanner and hear a noise while they are doing the CT scan. You will not feel anything and nothing will touch you. The scan will only take a few minutes and the radiographers are watching you all the time through a window. If you need them, just call out and they will come straight into you. When the scan is finished, the radiographers will come back into the room. Please keep still until they say it's okay for you to move. Tattoos. The radiographers will give you 3 very small dark blue tattoos. These tattoos are used to ensure you're in the correct position each day for your treatment. They are permanent and very small, about the size of a pinhead. You will feel a tiny scratch when they are done. When the radiographers have finished, they will help you off the bed and you'll be free to get dressed. If you have any questions, please wait until after the scan, as you'll need to keep still and the radiographers need to concentrate to ensure they get all the information they need. Before you leave, the radiographers will take your photo, which is then attached to your treatment information on the computer. This is one of the ways used to identify you. It is only kept with your records for radiotherapy and is not shared with anyone else. You will be given your list of appointments for your radiotherapy before you leave the department. If you have any questions following this short film, please contact the Linda Jackson Macmillan Centre on 020 3826 2555, who will either be able to answer your questions or will signpost you to the appropriate team.